This leaflet tells you what the new National Health Service is. Read it carefully.
In 70 years, the NHS has revolutionised the health of British people. We could now be on the threshold of the biggest revolution of all.
When the robot cuts in the right place.
Technology will soon change medicine as we know it.
I can look on the screen and then they've prescribed it from wherever they are. In seconds. In seconds.
In 70 years' time, diseases that have blighted the lives of millions of people may be on the verge of defeat.
That level of manipulation is happening.
But will what is good for us also be good for the NHS?
We have to be cautious and careful and make our own decisions, not just take what the marketplace wants to sell us.
Surgical robots are bringing science fiction to life, but they come with an intergalactic price tag. This is Mako, a critical member of this surgical team at the Princess Grace Hospital in London.
The robot now a very key part of your team.
It is a big part of the team. It's the best looking part.
Today, Mako's carrying out a hip replacement on Richard Ellis, who's 57.
I still walk the dogs, but rather slowly, and I generally have a stick now.
The benefit of robotic surgery is its precision, reducing pain for the patient with a shorter recovery time.
They will try and get me up by the end of today, which is extraordinary actually, isn't it, when I've just had an operation. It made perfect sense to me with recovery times and pain. That all seemed to add up rather well. So yeah, I think it was definitely part of the decision-making process.
We followed Richard into surgery and saw Mako at work. This, the robot's 200th operation. He also does knee replacements, alongside his boss, Professor Haddad, a pioneer of robotics in the UK.
So huge differences to me as a surgeon in that we've got much more detailed planning preoperatively. We get a CT scan which allows us effectively to create a model and do a virtual operation before we start. And then we have this wonderful feedback from the computer and the robot during surgery that allows us to adjust that plan very, very accurately. When the robot cuts in the right place.
Do you think the future for surgeons will be at a console pad and not in scrubs like you are today?
I think for my type of surgery, the future will still be scrubs and operating, but we'll be operating with assistance. And I think that's the beauty of this. I think there's no question that this is the future of surgery. There is no industry where the robotics have come in, where they've left again. It's the way forward.
Well, this may be the future. The NHS so far only owns one of these robots. It's expensive kit and not an easy transition.
So you mix traditional methods with robotics?
Traditional methods with robotics, because you've got to buy in. You've got to A, prove it works, and B, you've got to buy in the surgical community who is scared of losing their jobs.
Another massive breakthrough for the NHS is replacing paper with data. These computers may not look like much, but they're almost as powerful as a team of medics. They're already relieving much of a nurse's work, recording patients' conditions and using the data to issue doctors' warnings.
There's an awful lot in here that is automated now that makes their life quicker and easier and frees that time up to go and care.
We're in critical care at the Queen Elizabeth Hospital in Birmingham, virtually a paperless unit now. Can you believe these enormous charts are still used in most hospitals? One per day, per patient.
You can imagine if a patient stays in critical care for 3 weeks, there are folders of these. This would normally be scribbled all over and very unclear as to what the patient had received, whereas you can see yourself that this is very clear.
Every time you're checked at your bedside, the information is stored and shared.
The system will take that information and will compare it to what would be a well patient. When the patient's observations deteriorate, you want various people to know that the patient's ill. It will also fire the system to send out alerts and emails to various staff around the hospital.
And so without checking any records,
they can know that the patient...
This system alerts medics that someone is in a bad way?
Yes.
Out of critical care and onto a ward. Digitizing records means patients are getting their care faster.
Okay, Aisha, I'm just going to scan your wristband if that's okay. Lovely.
Aisha has been in and out of hospital all her life with kidney failure. Now, by having a digital profile, doctors can treat her almost instantly.
Everything just happens really quickly. If I need pain relief, the nurses won't even take 5 minutes to give it to me.
What does it tell you when you scan the wristband?
As soon as you scan the wristband, it allows you to sort of enter the rest of the programme, and then you can continue giving the medication because that's the correct patient.
And you can see all of this patient's profile?
You can indeed, everything comes up on the system.
And can you imagine living without this?
Never.
Yeah.
Never. I think it's just brilliant. It just really saves so much time, especially with the NHS now, how busy it is and how short-staffed you are, and having all of this together just makes your job so much easier. I actually have never known anything different unless I work in another hospital. Then you really see the difference.
And how much tougher is that with paper?
Oh, like it's just, to be honest, when doctors want to prescribe something, they have to take the drug chart away from the patient's notes. So if you want to go and administer some medication, you have to go and find the drug chart. Whereas here, I can ring the doctor and say, the patient's in pain, can you please prescribe some analgesia? And then straight away, I can look on the screen and then they've prescribed it from wherever they are.
In seconds?
In seconds.
If I go back 5-6 years ago, I'd have to be waiting hours on end for pain relief. And it wasn't the staff's fault, it was just the way the system was. And now all I have to do is ask and I've got my pain relief. I'm just so happy with it all.
But this is just the beginning of the sort of technology you may soon find on your hospital ward.
Fast forward to the future and your hospital ward could look something more like this, with a nurse able to adjust the conditions at the touch of a button, allowing you to sleep better. And because light has been directly linked to a patient's recovery, they can boost the amounts you get. And monitoring your condition could become far less invasive as well. By simply wearing one of these biosensors, medics will get all the information they need wherever they are.
We're at the Philips Research Laboratory in the Netherlands. This is where they invent the high-tech hospital equipment of tomorrow. Like this, using augmented reality to change spinal surgery forever.
We've added cameras to the system, so you are able to see on the outside of the patient, the inside of the patient. The alternative would be open surgery, so you can actually see what you're doing. Now we're providing visual feedback to the surgeon, so he can actually perform it minimal invasive. Minimal invasive means less of a wound, quicker recovery times, sooner the patient gets home.
This hybrid operating theatre means diagnosis and treatment can happen almost simultaneously. A team of surgeons, radiologists and other specialists can carry out X-rays and operations in the same room at the same time.
This sort of technology opens the door to untold possibilities for the future of healthcare. These are some of the most advanced bits of kit for treatment and diagnosis. Everything, like this ultrasound, is getting smaller, more powerful and more precise. And while this may look like a glimpse into the future, the reality is much of this is already on its way to the NHS.
The notion that all of the kit that you need to be diagnosed sits in a hospital changes. Ultrasound machines, which are large trolley-based bits of kit that are wheeled around a hospital, they're now handheld devices that can be plugged into an ordinary tablet, and they can produce 80 to 90% of the same kind of diagnostic tests today that large kit can do. So imagine what it will look like in 70 years' time. So the notion that the hospital, I think, comes to you, in the community, in your home, I think is a fundamental part of how the healthcare system will look in 70 years from today.
Digitising the NHS's store of tens of millions of medical records is another huge opportunity. It has a fairly disastrous record in data privacy and IT contracts, but if it can get it right, the NHS could find itself in a unique position.
I think the UK is better placed than, frankly, any nation on earth to put these kind of systems in hospitals. helping a doctor make sense of an incredibly complex range of data sources. Blood tests, urine tests, and soon data on genetics and gene regulation. It is just an incredible amount of data. And so I think that the way I would try to convince a skeptical member of the public here would be to point out how difficult a job a doctor has in trying to grapple with that complex situation, and making the point that the machine really could help them out a lot.
Data sharing offers huge possibilities for diagnosis. But what if doctors could preempt your illness by reading your DNA? Congenica is one company already working on the first stages of this process with the NHS at St George's Hospital in London, decoding a patient's genes to predict the best treatment for them.
When I first started my career, maybe about 25 years ago, we could look at very small portions of genes, and it was very expensive. And to look at a whole gene would take years, literally years. So patients would wait years for a diagnosis. Now we can do a whole human genome in the NHS. It can be done, and the results can be returned to patients within weeks.
But the next step is editing your DNA to eradicate diseases altogether. And this is something that could happen before you're even born.
We've seen so much change. You think about mitochondrial disorders, where a woman who carries a mitochondrial condition, even though she herself might be well, but her offspring are at significant risk of potentially really being affected by the condition. We have these new techniques which are just starting, where you transfer the nucleus from her egg, making sure you don't take any mitochondria from her egg, into another woman's egg where there are totally normal mitochondria, and remove the nucleus that's in that egg, and then she's able to have a child with great reassurance that the child won't have one of these devastating mitochondrial diseases. That level of manipulation is happening. So yes, it is on the horizon, I think.
But with that comes many ethical questions, that it could lead to social cleansing and a race of superhumans available only to those that could afford it.
I think there'll always be a minority who want to throw money at this. Loads of people are dominated by very superficial ideas of what people should look like and what their capacities should be.
Tom Shakespeare, who was born with achondroplasia, says it's a dangerous idea.
The number of people with disabilities who've built the world we live in is extraordinary. You and I and everybody else uses the internet and our smartphones all the time. Who designed that? Mostly people on the autistic spectrum. Silicon Valley, full of people on the autistic spectrum. We're in the heart of cultural London. Who drives the culture that we love? Gay people. These are the diversity and differences which make our lives better. So we don't need to start trying to make us all homogenous, white, heterosexual, able-bodied, 6 foot tall, boring, dull, unimaginative people.
History shows developments in technology have the biggest impact in transforming care. 70 years from now, the possibilities are almost limitless.
More effective, more personalized treatments, whether for cancer or chronic kidney disease.
There are many incredible breakthroughs within our grasp, but it's private companies that now hold the reins to innovation.
The notion that you go to a large place, a district general hospital or a GP clinic to receive your care, I think will change.
Financing healthcare will always be the greatest challenge. The vision for the future is packed with possibility.
It's not like on screen, it will be in your glasses, right? So if we still use augmented reality, it will be, what you see is, you see inside the patient.
But in solving new problems and answering tough ethical questions, we'll need the same creativity.